Good morning. My name is Karen Schmidt, and I'm the Vice President of Academic Affairs here at Blackhawk Technical College. On behalf of all of us here at BTC, we welcome our guests who are here on Central Campus, as well as those who are with us watching online. Today is an exciting day for us at Blackhawk. It is the culmination of more than a year of emergency planning and pandemic preparedness. Here at Blackhawk, we've been committed to the safety and wellness of our students, employees, and communities since the onset of the pandemic. Granted, when we started preparing for this pandemic last February, we had no idea we'd still be in the midst of it a year later. We are proud that we've been able to continue our mission of flexible education in a supportive environment during the pandemic. And I personally want to thank President Tracy Pierner and District Board Chairperson Eric Thornton for their leadership of the college during this period. In late April, many of our health sciences and public safety students returned for in-person instruction in labs, and in June, we reopened with additional safety protocols in place so we can continue the work of training essential employees to serve our communities. At the same time, we were working to prepare our campus for summer and fall semesters. Our incident management team, led by Brad Smith, manager of campus safety and emergency preparedness, tackled one pandemic challenge after another. We are pleased to report that thanks to the leadership of our incident management team and the safety measures they have put in place, BTC has seen zero community spread on campus. Our team also began researching and preparing for COVID-19 testing. We offered take-home tests for our students and employees, and we gained some invaluable partnerships in the community to help us in our efforts. Working with Rock County Public Health Department, the Rock County Emergency Operations Center, and the Wisconsin National Guard, we welcomed free community-wide testing to our campus. Rob Balsamo and Mike Schwartz from BTC served as incident commanders of the testing site through December, when the on-site transitioned to partners at Rock County. Despite the cold, that testing is still happening every Wednesday and Thursday in our parking lot here on Central Campus. When the fall semester returned, we began to turn our sights to the vaccine. We knew that several options would be available and on the horizon. We wanted to continue our great work here and to be part of the solution to getting our community through this pandemic. Last month, we partnered with Beloit Health System to vaccinate our faculty on the front lines of health sciences, public safety, and first responder programs. BTC also launched a pilot vaccine clinic in cooperation with the Rock County Public Health Department right here in the Student Success Center. I want to thank Director Lynn Neitzel and the staff of the Student Success Center for their help in sharing this space with the pilot clinic. The planning and coordination that went into that pilot clinic just a few short weeks ago is ultimately what led us here today. So without further ado, I would like to have you please join me in a warm welcome to Governor Tony Evers.
Well, good morning, everybody. It's great to be here at Blackhawk Tech and in the Janesville area. And thanks so much, Dr. Schmidt, for your good work, and also the president and the board of Blackhawk Technical College. I had a chance to tour the first community-based site that we're doing here in Wisconsin. So it looks great, and I'll talk about that in a few minutes. But thanks to all the people that got this facility to this point, at this point in time, to allow us to have kind of a grand opening. So this is going to be first of several across the state of Wisconsin. It all depends on the supply of the vaccine, of course, but we look forward to having more of these all across the state of Wisconsin, and our with our partnership with AMI also. The Wisconsin vaccination program has already become a big undertaking. As people know, we're getting shots in the arm all across the state of Wisconsin. And these things just don't happen by happenstance. They happen because there's a purpose behind it, because we have great people like AMI, like Blackhawk Tech, like the public health department in this county. It takes everybody to make this work, and we feel very proud of it. And a special thanks to Blackhawk Tech and the board and the administration and the students and the faculty that work here to take this on. They took on the issue of making sure that people had had the opportunity to be tested if they needed it, and now they're taking on this also. But it takes everybody to make that happen. The thing that I was really impressed, and this is the second one that I've been to, an opening something like this, but this is a community-based one, is how easy it's going to be for people. They'll be able to come, drive in, and essentially the flow of people through this facility as they get vaccinated, as they are observed, and then exit. It's all going to be very slick and very easy for folks. They will have people here to help people that may not have English as a first language, that may have other disabilities that prevent them from communicating in a way that a lot of other people do. And so we want to make sure everybody gets the opportunity to be part of this effort to get rid of the vaccine or get rid of the virus in the state of Wisconsin. I also heard from the AMI folks that this group of folks that were being trained in the back are some of the most knowledgeable and thoughtful and energetic around their mission to make sure that people in this part of the state get a vaccine, and that's really important. This is a labor of love. There will be no millionaires walking out of here because of their work. They're here because they want to make sure that this works for the people of Wisconsin. So, as I said, a lot of this success that we have depends on the people that will be here doing the good work, but it also, frankly, depends on the supply of vaccine. We've said this time and time again. If we get the shots, we'll put them in people's arms. If we get the supplies, we'll put shots into people's arms, and they'll be safe and healthy. And so that is part of the push and pull we always have with the system. But I feel confident that this community organization will be very, very successful with all the folks that are being trained, and the need is certainly needed right here in the Blackhawk area. So thanks so much. And now I'll turn it over to Dan Beck, who is the Senior Operations Manager for AMI and our partner in this endeavor. Dan?
Good morning. I am Dan Beck. I am the Senior Operations Manager with AMI Expeditionary Healthcare and Program Coordinator for Wisconsin Vaccination Program. First, let me say that we are very proud at AMI Expeditionary Healthcare to be a partner with the state and particularly be part of the governor's innovative solution to expanding the access of vaccinations to the citizens of this state. A little bit of background about AMI Expeditionary Health. We have been providing medical care and services to some of the most challenging and remote areas in the world for over 14 years. AMI is one of the leading American companies in the fight against COVID and has been engaged since the very first cases in Kirkland, Washington. Since that time, and beginning in early March of 2020, AMI has been providing medical care services fighting COVID, including alternate care facilities, testing sites, and now vaccination clinics. We take a lot of pride in particular in being able to be partners in this endeavor. The team that the governor mentioned that's been assembled to support this clinic here at Rock County at Blackhawk Tech are made up of 100% local hires from Wisconsin. These are folks from Wisconsin helping the citizens of Wisconsin. We could not be prouder to be part of that team. This entire project is a partnership, and as we know in public health, the only way that you're able to meet these complex public health challenges is by bringing a completely multidisciplinary approach to be able to partner at the state, the local, and in our case, the private level. Could not thank Blackhawk Technical College enough. Tracy Pierner, president here, and the incredible support of this facility really is instrumental to making this first pilot site successful. It truly could not happen without the support of Blackhawk Technical. So very thankful to the president and his staff, including Brad Smith, April Foss, who are absolute partners in this endeavor. Thank you very much. Also would like to thank Rick Wiederson and his team in the Public Health Department in Rock County. Again, their ability to make sure that we are doing our very best to make sure that this clinic meets the needs of those who are most vulnerable, those who are underserved, is going to be critical to the success of this as a pilot site. And lastly, to Mr. Governor, to your team, Anna Benton, and the entire team with the state COVID response, we're proud to be partners with that. As we talk about being parts of the community, and we hope that we are, we have also looked to build and continue to build partnerships here within the state. That includes partnerships with schools of pharmacy and schools of nursing throughout the state. We have agreements in place already with the Marquette School of Nursing. We have agreements with University of Wisconsin School of Pharmacy, with Concordia School of Pharmacy, and with the Medical College of Wisconsin School of Pharmacy in order to engage those pharmacy nursing students to help grow the capacity here within the state to meet this tremendous public health challenge. In fact, we will have our first pharmacy student will be joining the team here at Rock County from Concordia School of Pharmacy next week and will be part of the opening operations. And most importantly, as we look to continue to expand this capability, AMI stands ready to be able to scale these operations up, to not only scale the operations and throughput here at this facility as vaccines become more readily available, but also at the direction of the state to be able to increase the number of clinics we have throughout the state. And again, we could not be more pleased, more honored to be part of this partnership. Mr. Governor, thank you very much.
We have a few minutes if any of you have any questions. So raise your hand, let me know. A few minutes. Lauren?
I was wondering what the timeline, like, if you could take me back, when did the discussions first start to have a clinic like this, and how did we kind of go from idea to execution?
Here at BTC or in the state?
Here at BTC particularly.
Well, here at BTC, we started this discussion, as Dr. Schmidt said, we started the discussion early last fall. Thanks to the leadership of Brad Smith and Campus Safety and Security Office, he has been reaching out to a number of partners at the local and the state level for months. Because when we launched testing, we knew that the vaccines were on the horizon and it was only a matter of time, so we knew we had to make that shift from investigations and testing to vaccinations. So we've been committed to being a part of the solution here in the community to get us through the pandemic.
I guess when did the discussion start with AMI?
With AMI, that's a great question.
Sir, I don't know if you would like to. Go ahead. Throughout the process, as the state has been looking at the best ways to implement their statewide solutions, the biggest key has been where would be the best, most effective location to establish a pilot site. And as those discussions continued, and this finalization of this site is really only weeks old at this point. Blackhawk Technical College had hosted a mobile vaccination clinic here. This is a site and a concept that fits very well with how Rock County Public Health Department is looking to actually vaccinate the communities within the county. So it really became very much a synergy of the right site, the right county, the right solution from the state, and this became a very clear first location for the pilot.
And AMI has been working with the federal government on these issues, and they are a nationally known company that serves in this capacity all across the country. So there was an RFP process. They won that process, and here they are to help us make sure that people in this part of the state are safe and healthy.
Wisconsin has gone from being one of the worst, or I should say last states in vaccine rollout, to being one of the best, in fact, probably the best in the Midwest, based on some rankings. What are maybe 2 or 3 things that you can credit that to?
Well, certainly supply. With the dawn of the new administration in Washington, D.C., the president made a commitment to increase the supply. I think we're up to about 15% higher than we were previously. And the second thing that has been, I think, very helpful is the administration's desire in federal administration to kind of tell us what we're going to get, the supply, for three consecutive weeks. That gives the providers, some semblance of what they will be receiving in the supplies. I think those two, and also just kind of getting into the cadence. We have lots of vaccinators in the state, 1,500, some just starting, some not. And now I think there's a good cadence so that people are doing the good thing. But I will tell you, the ability to have a supply and the supply increase is absolutely critical. We have lots of people in the state of Wisconsin to vaccinate, and we need the supply. So we'll keep pushing that. But I think it was more of a matter of a slight increase in the supplies, making sure that people knew for a couple of weeks what their supply would be, and they gave them the comfort to expand the services at a local level.
How will this impact the state's overall allocation? Will the doses coming here come from the state allocation, or is there a separate allocation?
Yes.
And how does that impact where the doses go in the rest of the
Well, if the doses stay flat, that's a problem. I mean, we're opening this great facility. That comes from the state's allocation. So we need to continue to have, even if it's slow growth from the federal government, we need to have more, and that's why this site will start slow and smaller, and hopefully as things go forward, we'll get more and more supplies to this site, and then as that grows, we can have more and more sites across the country, or excuse me, the state. But it is contingent, and people have to understand this is going to be a great facility, but in order for it to grow to its fullest potential, we will need more because it comes from the state allocation.
When is this going to be officially open, and who is it going to be serving, just to remind people kind of what's open right now in terms of who's accessible to this?
The site will be operational next Tuesday, February 16th. The site will be open to any eligible person who meets the eligibility requirements to receive the vaccine. It is appointment only, so the state will be opening, and this will be available through Rock County as well, a registration system for those appointments. However, the goal of these state sites is really to be able to help the state as a whole reach out to and provide opportunities to address the needs of underserved and vulnerable populations and persons. So while it's open to everyone, the goal will be, particularly as we continue to grow these sites, that we're able to emphasize and use these as resources to address those most vulnerable.
So
We have time for one more question.
you were mentioning that the vicinity of Rock County here and the setup at Blackhawk Tech had kind of aided in the selection of this Rock County site. So there were no issues with previous vaccination rollout or anything like that that had led to this decision being made?
I would say the points you brought up are the reasons that we've selected this site, but also the fact is that in Rock County and in Walworth County and Greene County, there are lots of folks that don't have, aren't part of a health system or don't have health insurance, period. And we want to make sure that this site is a home for those people. And so that is one of the reasons this site was chosen.